Started. Good afternoon, everyone. I'm Dr. Al Khalaf, a postdoctoral research fellow at the University of Ottawa Heart Institute. I hope everyone is healthy and safe at this time, whatever you are. Thank you for joining us in our first COVID Spectrum panel discussion forum, a communications initiative in partnership with the Natural Sciences and Engineering Council of Canada, with a goal of navigating the waves of COVID-19 pandemic. Some housekeeping notes to help navigate the webinar today. The panel discussion is set up in 3 sections. First, each panelist will introduce their expertise with regards to our topic. The second section is a discussion between the panelists moderated by the chairs of today's webinar. That would be Dr. Lara Gharibe and myself. And in the last section, we will open the floor for an open Q&A discussion where our panelists are invited to answer your questions. If you have any issues connecting to the audio, you can call in by phone. Please refer to the email sent after your registration for phone numbers and meeting ID. For all of your questions, please use the Q&A function button on the platform, and we will direct your questions to our panelists during the open forum section of the webinar. This webinar will be made available on the COVID Spectrum YouTube channel soon after recording. Check our website and Twitter for video release announcement. Today, we have the pleasure of presenting our first discussion topic webinar titled The Effects of COVID-19 on Mental Health. And just as a disclaimer, this is a discussion webinar not meant to be taken as medical advice. And to help us navigate this topic, we have a panel of experts today. Let's introduce them briefly. And for this, I'll give the virtual podium to my partner and co-founder of COVID Spectrum, Dr. Gharibe.
Thanks, Mo, and thank you all for joining us today. It is my pleasure to introduce to you the panelists for our mental health webinar. I would like to welcome Dr. Ismail, Dr. Mcquaid, Dr. Sankar, and Dr. Woo. To give a brief introduction about our panelists, we will start with our first guest for today, Dr. Nafisa Ismail. Dr. Ismail is an associate professor at the School of Psychology at the University of Ottawa. Her research interests relate to neuroimmunology, neuroendocrinology, and development. Dr. Ismail leads a team that investigates the neurochemical mechanisms through which immune challenges and hormonal changes alter behavior, such as social behaviors, depression, and cognition. And to start you off, how do you think COVID-19 pandemic has affected mental health? Specifically, looking at it through your scope of expertise that we just mentioned. Dr. Ismail, please take the virtual podium.
Thank you, Lara and Mo. It's really a pleasure to be here and participating in this discussion panel. It's a very big question that you just asked, because the reality is that there are so many ways that COVID-19, the pandemic, the associated social distancing is impacting mental health. If I look at it from my lens, so my expertise, which is the underlying mechanisms of mental illnesses, the reality is that while we have identified certain pieces of the puzzles of the mechanism that underlies mental illness, there is still a lot that is unknown. And so the way that we currently see it is that perhaps mental illness is due to some sort of an imbalance in neurotransmitters. It could be either through decreased production or a more rapid reuptake, but this still needs to be identified and examined properly. But the stress that we are currently undergoing with COVID-19 related to the disease, to getting infected, related to adjusting to the way things are functioning differently now around us, maintaining physical distancing, all that causes a lot of stress, a lot of worry, a lot of uncertainty, which are all normal feelings during this time because we're all in this situation together for the very first time and we've never experienced this before. But this results then in elevated levels of cortisol in our bloodstream. And with elevated levels of cortisol, it is fine when they occur at a punctual time and then go back to baseline. But with our current enduring situation, we end up experiencing chronic stress where cortisol levels remain elevated for a long period of time. And that can lead then to an hyperstimulation of our stress axis that we call the hypothalamic pituitary adrenal axis, the HPA axis. And that will then impact the way that we will be able to deal and manage future stressors. So because of that, then it affects our ability to function in our environment and could then lead to mental illnesses. We also see that it affects men and women differently. It also affects children and older individuals differently. So we need to be mindful of everyone and understand how this current situation is impacting everyone. The other aspect of this chronic stress is increased inflammation. So when we are experiencing elevated levels of cortisol in our bloodstream, we are also experiencing inflammation in our system. And inflammation in the body can then cross the blood-brain barrier, enter the brain, and activate and cause neuroinflammation. And so this neuroinflammation will also affect neurotransmitter availability and functioning in the brain, which can also then impact mental health. And the other aspect that I want to mention here is sleep quality. So with elevated levels of cortisol, we all see an impact in sleep quality where we're not getting that deep sleep that our brain needs to rejuvenate and create new neurons and so on. And so we are left with some remainder of neurotoxicity in our brain, and that can also then impact mental health in individuals.
Okay, that's very interesting, Dr. Smail. Before I proceed with Dr. Mcquaid, I would just like to remind everyone that if you have any question for our panelists, you are encouraged to use the Q&A button that is on your screen. And our next panelist for today is Dr. Robin Mcquaid. Dr. Mcquaid is a scientist in the Culture and Gender Research Unit at the Royals Institute of Mental Health Research. She explores how adverse experiences interact with biological factors, such as genetics and inflammation, to promote or buffer against depression and suicide. Dr. Mcquaid, how do you think COVID-19 pandemic has affected mental health, specifically looking at it through your scope of expertise? Please, the virtual podium is yours.
Hi, everyone, and thank you so much for having me today. So thanks for that introduction. Like was just mentioned, a lot of my work actually kind of spans both the neuroscience side and the social determinant side. And so we just heard a little bit about the neuroscience. Thank you. So I think I'll focus a little bit more on just highlighting some of the stats today and some of the groups that may be particularly impacted by COVID-19 in terms of their mental health. So we know in general, just from Statistics Canada, that mental health is declining during COVID. So 54% of Canadians in general are suggesting that, are reporting that their mental health is excellent to very good now, and that compares to about 68% in 2018, so pre-COVID-19. But groups that are particularly impacted in terms of their mental health are, include women. So their mental health is declining, as are men during COVID-19, but women's mental health is particularly lower compared to 2018 numbers. And a lot of my research is actually on youth and young adults. So really, I look a lot at university students who have a high rates of mental health disorders and high rates of stress. And actually, we're seeing in this particular age group, their mental health right now, only about 42% of youth and young adults are saying that they are experiencing very good and excellent mental health. And that compares to 62% in 2018. So that young age group are really disproportionately experiencing some mental health challenges right now. But it's also people who are already experiencing mental health challenges coming into COVID that are going to be really impacted. So some reports are suggesting that, people who had a mental health disorder, perhaps a mood disorder, and an anxiety disorder, these individuals, their already high rates of anxiety and depression are now doubled in COVID-19. So we know that these pockets of groups of people are really struggling. And this is kind of in line with something that we call in the stress literature as allostatic overload. So we think about people who will really be taxed the most during COVID-19 in terms of their mental health are the people who were already potentially vulnerable before, people who were encountering mental illness and a lot of chronic stressors before. The pandemic may just prove to be ultimately too much for these individuals to cope with, and their biological systems may be taxed, which we just heard about. So it's these individuals and their mental health that are really going to disproportionately be impacted by COVID-19, and we're starting to see evidence of that today. And one factor that I've been studying a lot in my lab is really the impacts of loneliness on mental health. And just to highlight that youth group, currently today during COVID-19, their loneliness scores are much higher than the general population. So about 68% of youth and young adults are feeling lonely during COVID-19. And this is, I think COVID-19 has brought loneliness to the forefront. People are now talking about it a lot more, but it was already a really large problem prior to COVID-19 in many age groups, but youth in particular. In our research at university students, before COVID-19, about over half of our students were lonely. So we can imagine what COVID-19 is now going to do with the social isolation and the impacts that will further exacerbate their mental health. So I think I'll stop there for now, and thank you.
Thank you, Dr. McQuaid, for sharing these very interesting points. We will elaborate on these during our discussion question-answer panel. For now, I will move to our next panelist, Dr. Krishana Sankar. Dr. Sankar is a scientist in the Department of Physiology at the University of Toronto, researching the biology underlying diabetes. Dr. Sankar is passionate about communicating science, about advocating on behalf of individuals with diabetes, women in STEM, graduate student support, and mental health in higher education. Dr. Sankar, would you please tell us how you think COVID-19 pandemic has affected mental health? The virtual podium is yours.
Thank you so much. So first of all, I want to say thank you so much for having me here alongside these other amazing panelists. And since the neuroscience part has already been taken, thankfully, but that area is not my area of expertise. And also a little bit was spoken about social determinants of health. I might touch a little bit on that. So where I actually come in here is I'm a founder of a group called Grad Rights Slack. And so this group I started about 2 years ago. And so my focus within this group is more on the academic trainees. And so within that space, what I've noticed ever since the COVID-19 pandemic has struck, particularly in Canada and actually around the world, just because my group is worldwide, we've got over 600 members and trainees from all across the world in different places. And what I noticed is immediately as the pandemic started to strike different countries, there was a major influx of people to the group. And so how the group functions, it's essentially an academic support group that helps students, so whether they be graduate students or academic trainees like postdocs, help them during their writing process. So for example, if they're writing a thesis or a manuscript or a report or a comprehensive exam. And typically what I found personally when I had started that group, at that time I was still a student, I had found a lot of isolation within the academic environment. And because of that, needing that type of support that I have, I created that space and realized it was really necessary because there was a huge gap and many people wanted it. So coming back to the pandemic, I noticed within actually, I would say under a week, at least 300 more people wanted to join the group. So that was the fastest my group had ever grown. And that was because of the pandemic. Now, what happened in the time of the pandemic, as we all probably already know, we've experienced it, but students in particular were now left to fend for themselves. A lot of students were either left with no guidance. They felt there was lack of support. A lot of international students in particular, it was extremely difficult for them. They now found themselves in very dire situation, trying to figure out how to continue working and how to continue even surviving in the current situation without any family support around, any friends, being international, not having necessarily a safe space to go to. So there was a lot of worry and fear and stress around the entire situation. So they came to this to the group that I formed, and everyone was really quite tense. There was a lot of anxiety within the group. And so there's something that I do every Wednesday called mental health check-ins. And so that's where I've been checking in with the group on a weekly basis, trying to find out how people are doing. So the things that are coming up within the group are, nothing surprising, but very, very sad, where people are now stressed about finances. Because, I mean, being a student, one of the things, for example, if you're working within a lab setting, you no longer are able to go into the lab, which then translates to, can I finish my experiments? Which translates to, can I finish my degree on time? Which translates to, do I have to pay tuition again? And will I have now that financial support and backing from my supervisors to be able to pay me so that I can continue doing my project? So that has been one of the biggest topics being covered within the group, especially finances. Another thing is international students talking about not having family and feeling extremely stressed. They're extremely low on motivation and productivity. And typically speaking, within these times of writing, we tend to be isolated anyway without a pandemic, much less add a pandemic on top of it. The situation is far worse. And so that's another situation that has come up, where recently one of the members of the group was talking about having absolutely no family around, feeling extremely lonely, extremely unproductive, extremely unmotivated, very sad, and starting to deal with anxiety, possibly depression, right? I don't know, I wouldn't be able to say, but there was then this collective, what is nice about the group though, is there is this collective sense of community. And so there are suggestions and advice coming in from other people on ways to possibly tackle, the ways that you might be feeling. So for example, asking people if they have access to help, which is another part of perhaps a social determinant of health, right? So accessibility to resources, whether it be financial or physical accessibility issues. Also, the underprivileged groups have shown a lot that they are another group that have been highly affected by COVID-19. So whether that be, once again, access to things because of lack of resources. So those are some of the things that I have noticed within my group, and that's the place that I am coming from.
Okay, thank you so much, Dr. Sankar. And our last panelist for today is Dr. Kerry Woo. Dr. Woo is an assistant professor in the Department of Sociology at York University. His research focuses on political culture, migration, and cities. Dr. Woo studies issues of trust and how it affects prevention and control measures, and teaches quantitative methods used in sociology and the social sciences, with a focus on linear modeling. Dr. Woo, looking at COVID-19 pandemic through your scope, how do you think pandemics affect mental health? The podium is yours. Sorry, Dr. Woo, we cannot hear you. You're on mute.
Sorry, yeah. So thank you, Laura. Thank you, Laura. And thank you, everyone, for joining us. I'm a sociologist, and I use survey data a lot. So today I'm going to share three points based on my analysis of American data and then data about Canadians, and also data collected in China. So first is that it's been more than 3 months. So the question how the crisis has impact over mental health is that the impact has been like N-shaped, right? So since the March 10, early March, the outbreak started here, and then people has been experienced more mental health issues, right? And at the top to late March and the first few weeks of April, but the impact has went down a little bit, has gone down a little bit since late April. So there's an N-shaped impact of the COVID-19 on people's mental health. both in Canada and in the United States. So the survey data shows. So that's the first point I want to highlight. The second point is that, like we another two panelists have talked about, that it has impact unequally for women and men, right? But then I want to highlight the minority groups, especially Asians, Asian Americans, and Asian Canadians. That before the pandemic, Asians usually have better mental health, both in Canada and in United States, relatively to white populations, white Americans or white Canadians. Asians has better mental health, has overall better mental health. But since the outbreak, their mental health become like worse compared to white Americans and white Canadians. So this shows that how the pandemic has kind of like a disproportionate impact on minority groups. And then when in analysis, when I take into account the discrimination, like the negative experience they experienced during the outbreak, this variable explains away the gap between Asian American and white Americans in terms of their mental health, right? So it's really the rise of anti-Asian or in general the racist attacks during the pandemic has a huge impact on kind of like mental health of minority groups. So overall, the pandemic has negative impact in terms of mental health on everyone. But the racist attacks, discrimination people experience, especially minorities, people of color, they experience those attacks really kind of like explains why their mental health become even worse. So that's the second point I want to highlight. A third point is like, I'm a trust scholar. I study a lot of like, why do people trust in each other? Why do people trust their government or they don't trust their government? So one thing I want to highlight is people trust in each other, social trust, and the people's trust in government can buffer kind of the negative impact of the COVID-19 on people's mental health. So at the individual level, when people have more trust in others, when people have more trust in the government, the negative impact of COVID-19 becomes smaller. And at the place level, when there's a lot of social trust and then there's more political trust, the negative impact of mental health will become smaller. So that's in general, that 3 points like I want to highlight based on my analysis of data from United States, data from Canada, and also some data from China. Thank you.
Thank you, Dr. Woo. These are very interesting points that you brought in here. And this concludes our first section for today. Now in the second section, we will ask the panelists to answer some of the moderator questions, and we invite the audience to start sending us questions via the Q&A button on your screen in preparation for the open floor discussion. I'll give the podium now to my partner Mo for the first question.
Thank you, Lara, and thank you to our expert panel for this engaging discussion so far. So having heard so many different angles that are important when it comes to mental health, my first question is, the additional stress induced by the pandemic's need for self-imposed isolation will definitely disrupt the normalcy of normal human experiences. Individuals practicing social distancing, physical distancing, will develop more anxiety and become lonely, as we mentioned earlier. What do you think are some of the short and long-term effects on individuals' social behavior as it precipitates from the response to the pandemic so far? Maybe I'll start with Dr. Mcquaid with this.
So in terms of just the impacts of being isolated and being lonely, I think it is important to distinguish the two. So just because people are isolated doesn't necessarily mean that they're actually feeling lonely, and vice versa. Sometimes people can be surrounded by others and still feel lonely, right? So So we do have to tease those apart, but when we're talking about loneliness, loneliness is so concerning because it's been strongly linked to both, physical health diseases like cardiovascular disease and long-term. It's also been strongly linked to depression, anxiety, self-harm, and suicide. So loneliness is very, very concerning in terms of the impacts on our mental and our physical health in the long term. So I think now we need to be trying to focus on some potential policies and mitigation strategies to kind of buffer some of those effects that we may see following COVID-19.
It's important to remember the policy side here, where buffering the long-term effects for sure are going to be necessary with regards to the pandemic. And Dr. Ismail, do you have anything to add in terms of loneliness and the mental health aspect?
Yeah, thank you. So with the social distancing, because humans are such social individuals, it is definitely having an impact on mental health, because when we communicate with others, when we spend time with others, we see an increase in dopamine, we see an increase in oxytocin in our brain, and these neurotransmitters and neuropeptides are really important for our well-being. So it's part of that experience of happiness, where we are. I guess it affects these neuropeptides. They have an impact on so many of our behaviors. So happiness is one aspect of it, but all aspects of mental health, whether it's motivation, whether it's energy, and so on, all become affected by a change in these neurotransmitters and neuropeptides. So in the short term, they definitely have an impact. Long term, it all depends on what happens then to us once we come out of this pandemic. Are we able to sort of engage in social behaviors that are going to then sort of overcome these neuropeptide and neurotransmitters?
Thank you, Dr. Ismail. And Dr. Sankar, when it comes to loneliness, as you mentioned, definitely for graduate students and young professionals, early career scientists, there's definitely a need to address this. And I'm imagining that the pandemic definitely has an effect.
Yes, definitely. And so, like I had mentioned, one of the anecdotes from my group where one of the international students mentioned particularly feeling lonely. So, I mean, for me, what was nice to see though is that as a community, they were able to come together and, we were offering some sort of support virtually. But one thing that was nice to see is that, so that particular student was able to say they could purchase a ticket and hop on a train and go see some loved ones. So I think, after what the two previous panelists said, it's definitely something that I can see will have lasting effects and not just short-term effects. And the way in which the government or the systems in place are there to actually help to facilitate people getting over this is what I think will determine how well we do as a society in the long run after this pandemic.
And finally, Dr. Woo, you think that the effect of loneliness is probably magnified on marginalized and minority groups, I imagine?
Yeah, yes, I would say so. Yes, so in survey research, like whether people feel lonely is part of the mental health, like it's a measure of mental health. So that what I said about the COVID-19 has impact mental health in general also shape their people's loneliness, right? But then also having friends and having family around and then those social support will really have a positive impact or like minimize the negative impact of COVID-19 on people's mental health, not just for minority groups, but also for people in general. So yes, I would think yes.
Thank you so much, Dr. Wu.
So my next question for our panelists today, how do you deal with the overwhelming quantity and content of information coming in since the beginning of the pandemic? And could you comment on the relationship between mental health and the type of information getting disseminated? maybe Dr. Sankar would start with that.
Sure. So this one is a little bit close to my heart, more coming from a science communicator perspective. With the amount of information that's coming in, it's extremely overwhelming. And being a science communicator and someone who is trying their best to keep on top of it all, it can be a little bit overwhelming for myself. So much less those within society who are the non-experts public. Trying for them to try to figure out what is real versus what is not, having misinformation and disinformation being shared. That in itself creates a lot of confusion and conflict within people and people. So coming at it with a lot of empathy, at least from my end and my colleagues, has been extremely important in this particular time. Now, when it comes to being distressing and affecting people's mental health, that also takes, the amount of information takes a toll. I think a lot of people right now are in a state of constant worry and constant stress, and we currently don't have a treatment or a cure. So for that reason, whatever information is out there, everyone is trying to grasp at it and make sense out of it. And that can then start to lead to detrimental effects, as we've been seeing in the news, where people will start to follow misinformation or share it and have other people following it, leading to further issues. So I think that in itself has been extremely negatively impactful for quite a few people. Speaking from a minority as well as an immigrant perspective, what I've seen within those communities is a lot of information that's shared within the communities, and sometimes language is not being as accessible. So if information is shared in inaccessible languages, there starts to be a lot of confusion and frustration with the information that are coming into those communities, and people then having to try to figure out, what is right versus what is wrong, what they should do versus what they shouldn't. And so that's where I see that entire lens of all the overwhelming amount of information coming in, and then different groups trying to then handle it, and how they're handling it. It's been very difficult. So as I said, as a science communicator and my colleagues, we are trying our best to help alleviate a lot of those stresses when it comes to that.
Thank you, Dr. Sankar. Dr. Woo, what do you think about this question from your perspective, given that trust issues can interfere in here and people would be trusting a source versus another one? So can you comment on that, please?
Yeah, so that's a very good question. Like during the pandemic, a lot of scholars, survey scholars around the world, they're collecting a lot of data. And then one important question in the survey they ask is whether they can still trust the media, and then those trust issues, right? So that when we receiving a lot of information, a lot of times we don't know which sources to trust, right? And then also during the pandemic, people are more panic, and then there's a lot of rumors going on. There's a lot of theories that fake news going on. So people really need to, first, people really need to know what's going on outside in terms of numbers, in terms of deaths. But then when people that don't have access to this knowledge or numbers, they really really not good for their mental health, right? We rely in today's in media age, we relied on information in our daily lives. But then when there are a lot of rumors going on, we don't know which media to trust, which kind of numbers or news articles to read, to trust, then it's not helping people's mental health. So yeah, so the trust issue is really big, and then not just social trust, political trust, and then we need to really highlight the media environment, whether we can trust the sources, the information.
Thank you. Does Dr. Smail, Dr. Mcquaid have any other comments to add on this question?
Just one thing that I wanted to add with the current pandemic and all the fear and uncertainty comes also the issue where we want to be informed, and we want to kind of be informed all the time. So a lot of people have the radio on all the time, the TV on all the time, or they're checking compulsively on the internet to get the information. And that in itself is a stressor and a factor that can impact mental health. We just need to identify the few sources that we are going to trust and that are real. And then we don't need to inform ourselves all day long. We can check in just 2-3 times a day, and it would be sufficient to gather the information that we need for the day, and then move on and think about other things and do other activities.
Yeah, and just to quickly add on that, I think exactly what was just said is that we need to monitor our use and our intake, and that's actually the recommendations coming out, is really balancing and knowing what works. I think for yourself, if you're finding it really anxiety provoking, to know to limit your use, and so some recommendations are coming out suggesting that that's what we should do.
Perfect. Thank you so much. So I have the next question here. So recent surveys in Canada and the United States have reported higher levels of alcohol and cannabis consumption since the start of the pandemic and physical distancing measures implemented. What kind of mental health effects can precipitate from this change in consumption levels of alcohol and cannabis? And I guess we'll start with the biological aspects there. So Dr. Nafisa Ismail.
Yeah, so with drug and alcohol usage, of course, comes with neurochemical imbalance in the brain. It does seem that during the pandemic, people are engaging more in alcohol consumption and drug usage to maybe, I guess, overcome the stress and the worry and the fears that they are experiencing during this pandemic. But these are not good management tools, because we don't want to come out of this pandemic with other problems that we need to deal with that will emerge from heavy usage of alcohol or drug usage. So there are other things that as individuals we can engage in to manage the fear and the stress that we are undergoing, and that will not lead to secondary consequences.
And Dr. McQuaid?
Yeah, so there is quite a few statistics now coming out on this. The Canadian Centre on Substance Use and Addiction, where I actually used to work, they have a report that about 21 to 25% of people are now increasing their consumption, depending on age groups. And one thing I wanted to highlight is that often, substance use disorders and substance use patterns and problematic substance use often go along with mental health disorders. They're highly co-occurring conditions. And that actually it's now suggested that the people who are having the poorest mental health are actually the ones who are increasing their alcohol, cannabis, and tobacco use more so than others. And so this kind of highlights that fact that these aren't really separate issues, are often co-occurring conditions. And one of the things that unfortunately is being reported now as well is that people are dying more of opioid-related deaths during COVID-19 as well. So substance use is a huge concern during COVID-19, and even people with substance use disorders are really disproportionately impacted by COVID-19 as well.
And I think one of the things I've read is that the younger adult age population seems to have the highest reported increase in this. So I wonder if Dr. Sankar, you would have noticed that there's increased conversation amongst graduate students and early career scientists when it comes to their behavior with alcohol consumption and other.
Yeah, that's actually a good question. And interestingly enough, I have. Sometimes it kind of plays out a little bit like everyone's just, in the beginning, everyone's just saying out of fun, we're now stuck in a pandemic. What is there to do? And everyone's, thinking, okay, I'm just going to have a couple of drinks, and everyone's being social on Zoom and having a lot of Zoom parties socially. But then I started to see a pattern of people doing it more often than they probably were doing it before. So once again, I'm coming at it anecdotally. And so not only have I noticed that from within certain conversations within the graduate or trainee environment, but also even amongst my peers. And so within the millennial generation, it's the same thing. A lot of Zoom parties have been occurring, and a lot of those Zoom parties are accompanied by alcohol consumption. And people have eventually started noticing they themselves are actually consuming more alcohol the longer they're home. So those anecdotes completely align with the stats that have been shared before by Dr. Mcquaid.
Perfect, and I think Dr. Woo, I would imagine that marginalized groups might also report a difference in behavior when it comes to alcohol and cannabis consumption, even if it's maybe not captured right now by the data.
Yes, I don't have data for this, but yeah, maybe alcohol use may not gonna help for like minimize the negative impact. But one thing from data, like from my data, shows that exercise at home will really help, like minimize the negative impact of COVID-19 on people's mental health. But then again, there's a exercise inequality, right? There's pattern, like who can exercise at home, right? Some people, they live together with a lot of people and they don't have enough space to exercise. So there's a lot of patterns, like inequality patterns, especially among minority groups. They quarantine at home, but they don't have enough space to exercise at home, and the positive impact, they can't really kind of like they don't have the positive like kind of a buffering impact from the exercise. So that really reproduce the mental health inequality, right? The gap between minority groups and then maybe the majority groups has become even more significant, just simply because during the time, the crisis, the people isolated at home, and then they have not space to exercise.
Could I just jump in here 1 second? So I wanted to just make a comment on that. So that in particular has been huge for me personally, and I've been talking to others about exercising at home. So that is one of the ways in which I have dealt with this pandemic, needing to exercise at least 3 days a week. And so doing it from home, but like you mentioned, right, it's all about accessibility. Do you have access to the internet? Do you have access to like an online gym? Do you have access to YouTube, right? But it has been a huge way to help me and also my colleagues. I found, for example, an accountability buddy, and that's one way I think for those who are listening, and I know some people are asking about coping mechanisms, I definitely say any form of exercise is a great way to help to cope with this.
Thank you, Dr. Sankar, and thank you for all our panelists for your constructive opinions on these. We're going to start with the questions that are coming from our audience. And the first question I have here is for Dr. Mcquaid. So given the disproportionate decline in mental health in the youth demographic, matched with social distancing measures, do you have any recommendation of how we focus our supports for this group? I worry that all may not have access to online resources or may be limited because they can't leave the household to make a call to resources like Kids Help Phone.
It's a great question, and certainly there's an increased need for supports. I do know that a lot of organizations have turned to telemedicine, to chat lines, to Kids Help Phone in order to provide the support. But the question there, they're highlighting that even that might be a challenge for many, and certainly even internet connections in certain regions of Canada are not great. So I guess just in terms of like the tips that people are recommending, we just heard exercise, which we know can be very helpful for our mental health, could be helpful in terms of just trying to stay connected, even, seeing neighbors in a socially distanced way, following the rules for sure. I don't want to, but making sure that we're able to try and stay connected with family and friends, reaching out in any ways we can, going for walks outside, seeing neighbors. These are some of the recommendations that are being provided by organizations in Canada. But certainly I think online therapy, if it's possible, reaching out to those supports like Kids Help Phone, if it's possible, these are really good options that are available right now, and kind of highlighting that online therapy is quite accessible for some, and this maybe should be continuing throughout and after COVID-19, right?
Yes.
Thank you. So I have the next question here is directed to Dr. Sankar. Peer support groups are a great resource to help international students during the pandemic. Are there any other ways in which we can help international students, particularly in the longer term? Just offering social support may not be enough.
Oh, that's an excellent question, and I really wish we had something for that right now. I can't particularly say that I know that we do. So, from my experience, I know that certain universities would have specific resources for students. However, they may not be completely accessible for international students, depending on their healthcare plan. Currently, because international students I know will need to be paying tuition fees for the next semester. Once their tuition fees are hopefully covering those resources offered by the university, hopefully they can be covered for therapy. So just like Dr. McQuaid just brought up, I think an excellent way forward for international students would be to have access to therapy. I think therapy would be one way. Also support from their supervisors. I think that is paramount. A lot of students have been complaining about lack of support and lack of understanding from supervisors. And if those supervisors are not there and not able to give that support, one piece of advice I would say to international students is to look within your department, and sometimes look even outside of your department. Look for all the resources within your university to find out and find allies and find people who can help you and point you into the direction of some sort of help. Within Canada, I know we have places like CAMH, we have jack.org, I believe, with resources to help people with mental health. I don't know specifically if they are accessible to international students. So those are things that would need to be researched by the person. But I would say whatever it takes, keep reaching out to different parties and finding allies in order to help. I don't know if anyone else on the panel would have different or added advice.
Thank you, Dr. Sankar. This question here is directed to Dr. Woo. What do you feel about the effects of pandemic on marginalized communities, particularly the ones already affected through the intersections of social and political and cultural dynamics of gender, class, race, and caste?
Yeah, so it's really like the impact. The impact of COVID-19 is unequal, right? So especially the vulnerable group, like minorities, women, or like homeless people, but they have no place to go, right? So for example, one research I've done is that looking at the gender gap in terms of transmission, right? Who are more likely to contract the COVID-19 is like, there's a pattern. During early on, most transmission is travel related. But then after like a few weeks, when the community exposure or community transmission becomes the main transmission pathway, then women, especially women during 25 years old and 40 years old, during that middle-aged women, they are most likely to contract the COVID-19 through the community exposure, through the community related, right? So that because one reason I would say is that because like there's a division of labor, like women still do like the unequal in terms of like household work. They still have to go out and then do grocery run. But then males, they are more likely to stay at home. They do in terms of like travel related. Early on, they are more likely to get the COVID-19 through travel related transmission. But then females, the gender inequality or gender norms really push women to go out to, like, maybe they use public transit more than males, and then they go to grocery stores, do grocery run more than males. So they are more likely to contract the COVID-19. That's one thing. The other thing is like in terms of mental health, right? Because they have family to take care, right? Even if there's a family member who are sick, they are more likely to have to like be more responsible in terms of taking care of their family. So in that, give them another layer of mental health stress, right? So that's also like the impact is unequal, right? And then also we can talk about race, we can talk talk about the social economic status, right? So like lower class or lower income groups are more likely to be affected mentally in terms of mental health, but also other aspects of the negative impact.
Thank you so much, Dr. Woo. So I'll direct the next question to Dr. Ismail. So the question is, when it comes to other mental disorders that have a non-typical neurochemical component to it, maybe such as OCD, bipolar disorder, etc., how do you think that the increased level of anxiety related to the pandemic might add on and affect folks that are already experiencing mental health issues?
Yeah, very good question. And as Dr. McQuaid mentioned earlier, individuals who already have symptoms of such mental illnesses are going to be more affected by the pandemic because we are going to see greater imbalances in these neurotransmitters, neuropeptides, functioning of different brain areas that we are seeing. So we are expecting an increase of symptoms in various mental illnesses that are associated to anxiety, like obsessive compulsion is one that we're expecting to see increases. Post-traumatic stress is another one that we're expecting to see an increase in the prevalence following the pandemic. And it all has to do with how we manage and deal the situation that we're in, the stress level that we are experiencing, the anxiety that we are experiencing. The better we are able to manage these, the better we will be able to help our mental health. So we will be able to improve these symptoms and decrease the impact of stress on these mental health symptoms.
Thank you, Dr. Ismail.
Thank you, Dr. Ismail. And as we bring our mental health webinar to a close, on behalf of the COVID Spectrum team, I would like to thank our attendees for their participation, and we hope that this webinar forum has given you a clearer understanding of the effects of COVID-19 on mental health. I would also like to thank our panelists for accepting our invitation. Your expert opinion is much needed during these times. One last question for our panelists, and I will invite you one by one to give your answer. What is the one thing you want the audience to do or to know as a way to progress coming out of this discussion on mental health? We can start with you, Dr. Ismail.
So one message that I would like to share is in ways you can manage your mental health, you can manage your physical health. And there are different ways that you can do this. So physical exercise is one that we mentioned. Having a good sleep hygiene, so sleeping at a regular time, not being exposed to computer and so on, white light before going to bed will help with being able to sleep better and will improve mental health the next day and so on. So that's quite important. But get to know yourself, learn about how you are best able to manage your stress and your anxiety, because different people are going to do it differently and different techniques are going to work differently in different people. So other ways that stress can be managed are yoga, meditation, and so on, reading a book, but it really all depends on each individual's personality.
Thank you, Dr. Ismail. Dr. McQuaid?
Yeah, so I guess just one message I really wanted to make sure that I kind of left and that got out there today was just about the people who kind of will be disproportionately impacted by COVID-19 and their mental health. So people who were in crisis before, who are marginalized, who potentially are living in poverty. It's these people who will be disproportionately impacted in terms of their mental health of COVID-19. And so for them, the effects will be profound. So what's needed is really research and really policies that can particularly target what is needed in terms of supports and services for these individuals who are already in crisis mode before the pandemic hit.
Thank you, Dr. McQuaid. Dr. Sankar?
So for me, I would really like to reiterate both what Dr. Ismail and Dr. Mcquaid said, specifically what Dr. Ismail said, just because that is also what I'm doing personally in order to cope. Not only, like she mentioned, it's not only just exercise and the different types of exercises, but the fact that you want to maintain that social connection and then have a routine. Just because we're in a pandemic doesn't mean we need to consume the news all the time or be on social media all the time. Learn to create your days as though you were still going to work and living prior to the pandemic. And also, I want to, for any students that are out there listening, I want them to know that places like my group, Red Right Slack, and other places are open for peer support, different types of support. I think it's really important that we're all able to access resources. We may not all have access, but there are resources out there. And if you just go online, if you have access to a computer or perhaps a friend or someone, go online and find resources that can help you. If you're able to help yourself best during this time, I think it will help in the long term as well. So once there is that social connection and reaching out to resources when you need the help, I think can be very, very beneficial.
Thank you, Dr. Sankar. And Dr. Woo, we'll end with you with this question.
Thank you. Based on my research, a message for everyone for now, but also for future outbreaks is that really be considerate and be nice to each other and have some trust in each other, right? And in Canada, maybe we can trust in our government and also health officials, and then that really help that to kind of minimize the negative impact of the outbreak on our mental health, not just us, but also for everyone, right? So that trust in each other and then trust in government in Canada.
Thank you so much, Dr. Woo, and thank you so much, Dean, on the economy. So stay tuned for that. Visit our website, www.covidspectrum.com. Follow us on Twitter at COVID Spectrum and subscribe to our YouTube COVID Spectrum channel. If you have any comments or feedback for us, we would love to hear back from you. For that, you can visit our website and go to the Contact Us page and send us your message. Until next time, stay safe, whatever you are.